Hello and welcome back to my channel. The purpose of this video today is to inform you of different services that I am going to walk you through step by step. And that's this application, which is from the Illinois Department of Human Services. This is the form for the cash assistance, the medical assistance, and the Supplemental Nutrition Assistance Program, SNAP. Now this application can be found on the internet, and what you're going to do is you're going to go to www.dhs.state.illinoisu.us, and you're going to download this application, and you're going to look on the right hand corner. On the bottom, it's going to give you this form number, because this is the form that the Department of Human Services wants. And it's going to have Illinois 444 2378 BS. And in parentheses, it'll say R0921. This is the number to the application that you are going to submit. Beginning with the beginning part of the form, you're going to put your last name first and your first name. You're going to fill out your address, phone number, all your information, and then you're going to sign it. You're going to put your signature and your date of when you are going to submit this application. If you want someone to represent you, you're going to approve of them, yes or no. You're going to check in one of the boxes, and you're going to let the provider put their name, the address of the agency, their organization name, their phone number, and the person you want them to represent you. They're going to sign it right here. Now this part at the bottom is the instructions on how to fill out the forms and what to expect, right? And so number one is going to tell you on how they want it to be legible, okay? They want you to write it so that it's clear and they understand it. Number two is going to be how the agency wants you to complete this form with your name and address and all this information, because if you don't, they're not going to accept the application. Number 3 is 14 and 15 has to deal with your rights and responsibilities towards your SNAP benefits. And then number 3 is going to be 16, 17, and 18, your information on your rights and responsibilities towards your medical and your SNAP benefits and your cash benefits. And then number 4 is going to states that if you don't sign page 18, they're not going to accept your application. So that's basically what's on page number 1 for the application. The application is 18 pages long, and it's in depth. It has a lot of detail. So if you think that you need assistance with filling out this application, you can go to our website, yolandasocialcare.com, and we can guide you as to how to fill out the form and help you submit it. We could support you in any way that you need as far as getting the information and the application. So if you need assistance with getting your medical bills together so you could submit them and your documentation, we can also make copies for you and make sure that everything is right before you send in your application, so it can speed up the process as far as them approving you, right? So, and it's also in Spanish and in English. So we do both. We do Spanish and English. On the second page, you're going to talk about if you are a citizen, you need information. They're going to ask you information about your citizenship. And that would, if you're not, don't have all the documentation, you can skip this one and just put yes or no. And then when you go for the interview, you can bring in all your documents and they'll document that for you. General household questions like, are you or anyone who's living with you blind? Yes or no. Disabilities? Yes or no. Number two, does anyone in the household have social security disability or any of the other services? Yes or no. And three, does anyone have a physical, mental, or emotional health condition? Yes or no. Number four, does anyone applying for a nursing home facility? Yes or no. Number five, does anyone your household help pay for medical expenses from the last 3 months? So what it is once you apply for the medical, they cover all your expenses 3 months prior. So you'll be covered, so if you're in April, they'll cover January, March, and April, right? December, January, February, March, and April, right? So, and number six is, has anyone in the household been in foster care at age 18? Yes or no? And then seven is anyone in the household 18 going to college? Yes or no? And all this information is important because um, if you don't have any of these, you just have to put no, and then the rest of it, they already know it's an A, not applicable, okay? Language preferred, this is important because when they do the interview with you, they're gonna ask you whether you want an interpreter or not, right? And so here it's going to say, um, does the adult member of the household discuss with the DHS speak English fluently? Yes or no? If you put no, you have to put on the line what kind of language you're going to need. Will it be Tangalo or whatever kind of like Spanish, whatever it is that your dialect is, you're going to put it on that line so they can have an interpreter there for you. And then, if no, please write down the language that you prefer, right? And that's page number 2. Page number 3 is household composition. How many people live in your household, and that's including you. So so if it's just you that's gonna fill out the application, then you're gonna put 1. But if it's more people, like if you're gonna add your wife and your children, then you're gonna add like 5 or 6 or whatever it is. So each person 1, is gonna fill out this part, right? And if you have more than one person filling out the form, then you go to person 2. So we're going to stick with number 1 because we're going to just do one person. So we're going to put their name, their first name, and their last name, and what they formed. So if you were married before, you're going to put your former name, right? And the relationship. This means that this is just you that's filling out the form. And then your social security number, whether you're female or male, date of birth, if you're married, divorced, widowed, single, what kind of, your marital status, right? If you're pregnant, and if not, then it doesn't pertain to you, put N/A, not applicable. And then how many babies are you expecting? If you're not a male, then you don't have to fill out this either. Are you applying for medical assistance? Answer to the questions, all these, right? So if you're gonna do the Medicaid card, you have to answer these questions. Number 1 is, do you plan to file federal and state tax this year? Yes or no, right? And then number 2, will you file jointly with a spouse? Yes or no. Number 3 is, do you have any dependents? Yes or no. your taxes, yes or no. And then, the number two person is the same questions that you're gonna answer. And if you're just you, then you just skip that number two. And then number, three, page 4, you're gonna go person 3, you don't have any people. Number 4, you don't have any people, you're gonna skip this page, right? Number 5, page 5, you're gonna skip page 5 because you don't have person 5 and you don't have patient. Person 6 is just you, number 1. And then we're gonna go directly to if you are applying for the SNAP benefits, right? And so this is more detailed as to how much money do you or anyone who lives with you have on cash, checking, or savings. Then if it doesn't apply to you, then you're gonna put N/A, meaning not applicable, because some people are not working, some people got laid off, and you're waiting for them to give you, some benefits from your unemployment or whatever. You can fill this form out for assistance, and they will help you. What is the monthly gross income? If it doesn't apply to you, put NA. Shelter costs, if you're living in a shelter home, this information needs to be filled out. And then the following is like if you're paying for light, water, garbage, cooking, fuel, all these, you're gonna put the amount, how much you owe, and amount you've paid, and what other bills you need to pay. So if this doesn't pertain to you, you just put NA, 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 right? Not applicable because you're not working. Okay, so if you're not working, this doesn't pertain to you. But if you're working, if you know the answer to those questions, try to fill it out. Migrate or seasonal farm worker questions. If you're not doing any of this, doesn't pertain to you, make sure that you put yes or no, you put no, and then you put NA, not applicable, right? Benefit information has the Prime application receives SNAP benefits in any other state? Yes or no? Is the applicant a resident of domestic violence shelter? Yes or no? So if you're in a domestic violence relationship and you're in a shelter home, you're gonna put yes, and then you're gonna go to the next part of the application, right? Application review, cash and SNAP. This is information that you're going to answer whether you want SNAP or whether you want cash. And then you're going to say, I am available to come into the office for an interview. If you're able to come in, you can check that box with an X. If you're not able to, you're going to check, I must be interviewed by phone because. So for example, if you are a kidney dialysis patient and you are attending your treatments 3 days a week, you're gonna put there unable to attend due to kidney dialysis treatments 3 days a week, 4 hours a day, you're gonna specify, right? And then you're gonna put why you cannot attend, right? If there's a doctor's appointment or whatever it is that you are dealing with, and you can't make it in person, then you let them know, right? But if you can make it to the office, you're gonna put a check mark where it says, I'm able to attend the office. And then, where it says, I am applying for cash assistance, you're gonna put an X on that. And you're gonna put an X on I am applying for SNAP. And then you're gonna put, I can be reached by phone Monday through Friday. And then you're gonna use the days that you are not going on to your kidney dialysis treatments. You're gonna put those days that you're available here, like Tuesdays, Thursdays, and Fridays from 9 to 5, because the office is open from 9 to 5. So you're gonna be able to talk to them from 9 to 5. So that's page 7. Page 8 is income benefits and expenses. So this is where you're going to talk about if anyone in your household is currently employed, yes or no. If you put no, then you're just gonna put NA on the person part because nobody's working. But if somebody in your household is working, then you're gonna put their name, the person who's working, their employer's address, their number of how many hours they're working, and they get paid weekly, bi-weekly, or monthly. You're gonna put the employer's name, the employer's phone number, and what you're getting before taxes, right? And that's just one person. So if it's just one person, then as many people as you have working, then you're gonna fill out the rest. And then you're going to, whatever doesn't pertain to you, you're gonna put NA, not applicable, right? That's number 7. That's number 8. Number 9 is American Indian and Alaska Native family members. If you're not American Indian or that doesn't pertain to you, it'll say yes or no, put no, and then go to the next section, which is SNAP and cash application, right? So have you or any other person applying for cash been convicted of a felony violation or drug violation? Yes or no? And then you're gonna put no. If it's yes, you're gonna put the name of the person. If a drug related felony conviction was not, did the felony take place more than 2 years ago? Yes or no? And then you're gonna put no, right? And then if a person is violating the parole or probation, yes or no? These are questions that you have to answer because this is important for them to know whether you've been convicted of felonies. Family health coverage. Okay, so if you need Medicaid, if you need the Medicaid, this is the family health Medicaid portion of it. If you had Medicaid at one time, you're gonna put an X on Medicaid, and you're gonna put your provider number, right? Your 9-digit NIR number. You're gonna put it on that line. If you have CHIP, if you had Medicare, if you have Medicare, you're gonna put X, then you're gonna put your Medicare number. If you had, you're gonna check the boxes that pertain to you, right? And then if you were working and you got your insurance from your provider, you're gonna let them know who was your provider and how was the coverage, whether it was from your employer and what their name is and their address and their policy number, things like that. That's number 10. Page 11 is family coverage from health. Say for example, you had your husband working, if he was working, and he had coverage for you, your spouse, right? You're gonna fill in this part. Does the employer offer a health plan and plans 80% and the cost? All this information is projected toward your employer. So best to your knowledge, fill in all the coverage that your company is giving your family. This is your family health coverage, right? Okay, number 12 is resource information. For example, if you have other entities, like you own a building or you have property or whatever, this is the one that you're gonna fill out, and it's gonna say complete only of the person who are blind and have a disability or are the age of 65 or older. If married and living with a spouse, resources from you own or your spouse owns, and it'll ask you, does anyone own property or vacation home or shares? Or you're gonna say yes or no. If no, put no, and then put NA, not applicable, right? Does anyone own a car, a motorcycle, a trailer, a vehicle, any kind of vehicle? Yes or no? And then if yes, you're gonna put that information there. And then, does anyone own any life insurance? Yes or no? You're gonna put the policy and who it's from, right? And then, does anyone have insurance policy? And then if you have an insurance policy, you're gonna give them all this information as to whether you have savings, a checking account, anything that pertains to you, you can check. If not, just put where it says other, none, right? On the bottom part here, it's gonna ask you, do you own property in Illinois? Do you own other state properties? And all this is, if it doesn't pertain to you, you're gonna put N-A, not applicable, right? Okay. On page 13, this is employment related expenses. So if your employer is deducting any of your gross income or whatever, if you're working part-time or if you're working and you're not making enough to make ends meet, you can fill this out and put in all your information on your pension and your employers and things like that. This is important because sometimes if you're not making enough money, they will supplement your income, right? And then this is 14 and 15 are your SNAP client rights and responsibilities. These are your responsibilities as far as what to expect for the SNAP program. And then 16, 17, and 18, this is your rights and responsibilities as far as your medical card and cash benefits. So once you read all this, then you're going to sign page 18 where it says applicant and you're going to date it. And then if you're married or a spouse, you're going to put spouse. If not, NA, if not applicable. And then read all of this information and make sure you're knowledgeable as to what pertains to you, right? Because it's really important for you to know what you're responsible for. And it's in Spanish as well. So if you have any, you need any help with any of these forms, whether it's cash benefits, medical benefits, or food assistance, let us know and go to yolandasocialcare.com and we'll help you fill out the form and we'll help you understand what to navigate as far as downloading it and what website to go to and all that information that you need help with, we can help you with that. And thank you for listening to my video, and I hope that you press that like button and that bring that notification bell so every time I put out a new video you can get notified, and make sure that you like our video, because whenever you help us, we help other people within the community, and that's what we want to be able to do. We want to be able to, our goal is to be able to open up a shelter home so we can help moms and their kids have somewhere to go when they're in some kind of need, right? Whether it's domestic violence or whether it's just like a fire or something that traumatizes the family, we have somewhere to help them go, right? So I want to thank you for listening to my video, and we hope that you continue to support us. Thank you. Bye.